Hello everyone, welcome back to my channel today. I am Choma Liu and I'm back again with a very important topic. This health talk is very important for parents and caregivers. We all know how important vaccination and injections are for our children, especially when children are sick. They need injections. Sometimes doctors give them injections for them to get well. Or when they are born, they have routine immunization they should take or receive within some period of life, and they need vaccination. These vaccinations, these injections are vital for the safety, for the healing and vaccination of our children. But do you know that there are several reasons why injections shouldn't be given into the buttocks of a child under the age of 5 years? In this video, you will be knowing why it is dangerous and risky to give children under the age of 5 injections in their buttocks. Now, several researches have proven that there are several risks when it comes to children under the age of 5 receiving injections in their buttocks. I will be listing these dangers or these risks to you in this video so you can learn. Now follow me so you know what these risks are. Now the first one here is muscle damage. You know, the muscles of our children are still developing, especially children that are under the age of 5. Their muscles are still developing. They are not mature. If you give injection into the buttocks of a child under the age of 5, you could interrupt the development of the muscle. It could lead to a damage in the muscle tissue. It could lead to atrophy. It could lead to weakness and even contracture. Then another risk is sciatic nerve damage or nerve damage. Now, in the buttocks of a child or in the buttocks of every human being, both adults and children, there is a special muscle. There's a special nerve that runs through the buttocks of an individual. And this nerve is called sciatic nerve. And that is what helps with the movement of our legs. Now, if you give injection into the buttocks of a child under the age of 5, it could lead to damage of this nerve. Now, anatomically, or let's say the position of this nerve now, for the children who are under the age of 5, this nerve is usually at the surface of the buttocks. So you see why children are more at risk of having sciatic nerve damage when they receive injections into their buttocks. So when injection is given into the sciatic nerve, it can damage it. It can lead to numbness, to tingling, weakness. And you see sometimes the child may not be able to move very well again or move the legs. That is another risk, the second risk now. Then the third one is risk for infection. There is risk for infection when you give a child that is under the age of 5 injection into the buttocks muscle. The buttocks muscle is also called gluteus muscle. When you give injection in this site, it could be a risk. It could lead to the risk of infection. Do you know why? Because that area is prone to deaths and accumulation of bacteria, which is very bad. So you can be exposing your child to another infection when you think you are actually treating the child. Then another thing is absorption issues. When you give injection into the buttocks of a child under the age of 5, the fatty layers of the buttocks will delay the absorption or will disrupt the absorption of the injected medication, leading to poor efficacy or reduced efficacy. And that is very terrible. It will make the medicine not to work very well, and it could even delay the onset of the action of the drug. So this is what giving injection to under 5 years age into the buttocks. These are the things it can actually lead to, and they are not very good. What about the safety and comfort of the child? Most of the time when you give a child under the age of 5 injection in the buttocks, it makes them to be uncomfortable, especially because of the pain after the injection. They will be afraid to sit down. They will be afraid to receive any other form of injection again through that site. And even sometimes children, when they start struggling, when they are receiving the injection, maybe they're under the age of 5, they start struggling with the healthcare provider, they could even get injured. So it is wrong to give injection into the buttocks of a child under the age of 5. Even the World Health Organization has also advised, they've given guidelines, statements to the world, even to the healthcare facilities. They encourage that every child who is under the age of 5 should not receive any form of vaccination or injection into the buttocks muscle. Even their immunization position paper, their vaccine administration guidelines, and their safe injection practices all are pointing to the fact that injections should not be given to the gluteus muscle of the buttocks of a child under the age of 5. It is very dangerous. It is very risky. You could predispose the child to risks. Now, it's not that adults are not at risk of sciatic nerve damage now. Like I told you earlier about the nerve that runs through the buttocks. Adults are also at risk of nerve damage, especially if they choose to receive injection or vaccinations from quacks. But do you know that these risks are very low compared to children under the age of 5? So that is why we are pointing towards children under the age of 5, because they are more at risk because of the position of the sciatic nerve. It is so at the surface of the buttocks of the children, not like the adults who have more mature muscle mass of the buttocks. So please, as a mother, as a father, as a caregiver, do not give a child under the age of 5 injection or vaccination into their buttocks. It is risky because researchers have proven it over the years that it is risky for children under the age of 5 to receive injection into their buttocks. Now, there are alternatives to giving injection in children under the age of 5. There are other places that are safe, very good, best locations to give the injections. And these places are the thigh. The thigh. There is a muscle on the thigh that is called vastus lateralis. That is where a child can receive an injection, an intramuscular injection. Or the muscle at the upper arm, which is called the deltoid muscle. It is also a safe place for a child to receive injection. So this is what I am advocating today. Even the World Health Organization, they advocate the safe and best practices of immunization and injection techniques. They don't advise that children under the age of 5 should receive injection in their buttocks. It is very risky. Let your child receive his or her injections or vaccinations in their thigh. That is the vastus lateralis muscle of the thigh, or the upper arm, which is called the deltoid muscle. And please, I'm also advising you, parents, caregivers, do not allow your child to be treated or to be given injection by a quack. It is very bad. So many children have come down with long-term disabilities, paralysis, due to some of these bad way of living and practices when it comes to injections or vaccinations. This is what I have for you today. And I know that with this video, you can help so many people in the world. Please share this video. Subscribe to my YouTube channel because you have so much to learn